Upon completion of the caregiver instruction, we'll utilize the teach back method. Using the teach back method will allow the parent or caregiver to show us how they've placed the child in the car seat and properly secure them. We'll watch over them while they're doing it, and then we'll double check after and make sure that there's no recommendations that they may be able to change. When the parent's placing their newborn in the car seat, we'll want to make sure that they put their bottom all the way to the rear of the car seat. Pull their arms through that shoulder strap for the harness system. We'll make sure that there's no twisting in the harness system. We also want to make sure that that crotch clip is close to the baby as possible without the child actually sitting on it. Want to make sure that they tighten that harness system and that they're checking the pinch test after, making sure that they can't grab any extra webbing. We want to make sure that we point out that they need to do this every single time the child is placed in the car seat. They'll check the chest clip and make sure it's high enough, just at armpit level. And this child looks appropriate. There's no aftermarket products added. These shoulder pads came with the car seat, so those are appropriate. They may have some objects that are in the car seat that came with the car seat, and those are appropriate to use. If there's any question whether or not something may or may not be used with the car seat, refer to the car seat manual. We'll want to make sure that the parent also verbalizes that this child needs to remain rear facing until they're at least 2 years old, 40 pounds and 40 inches tall. If they need any help with the placement of their car seat inside their vehicle, they'll need to make sure that they utilize a CPS certified technician, and we can give them the information for that. It should be available in the packet that they got when they first arrived at the hospital. The next thing I'll do is make sure that I'm charting that this education is completed utilizing the teach back method. I'll also chart any suggestions that I had to make to the parent to make sure that their child was secured.